Hello and welcome to my channel. This is Ayush Chatterjee, currently a second year student of Medical College, Kolkata. I am starting a new video series on the pathologies of liver, and every week I am going to release a new video. Welcome to part 1 of this series. Now before we start with any pathology, let us revise a few basic concepts regarding the normal histology of liver. This is an image of an hepatic lobule consisting of a central vein and a portal triad. Now, as we know, hepatic lobule can be further divided into three zones. Zone 1 or the periportal zone, Zone 2 or the intermediate zone, and Zone 3 or the pericentral zone. Now if we focus a bit further and concentrate on a single portal triad and central vein, we see that the blood from the arteries and the veins will drain into the sinusoids. The sinusoids further carry this blood to the central vein. Sinusoids have specialized macrophages known as Kupffer cells in the liver. The space between the sinusoids and the hepatocytes is known as the space of Disse. These space have specialized cells known as the stellate cells or Ito cells, which when activated due to any injury helps in the process of fibrosis. Now before going on to individual pathologies of the liver, let us know about the concept of liver failure. It is the most severe form of liver disease and the ultimatum of any liver pathology. It can be further of two types. Due to an acute exacerbation, there can be acute liver failure, or a chronic persistent illness can result in a chronic liver failure. Acute liver failure. Acute liver failure consists of an underlying acute liver illness plus encephalopathy and coagulopathy. To call it acute, it must occur within 26 weeks of the primary illness. The most characteristic feature is massive hepatic necrosis, which led to the sudden failing of the liver. Due to necrosis, there is loss of parenchyma, as a result of which the liver shrinks in size. Some of the common clinical features are jaundice. Cholestasis occurs due to alteration in the bile formation and flow. Next, we have encephalopathy due to accumulation of ammonia in the brain as it is not being able to metabolize. Coagulopathy occurs due to deficient synthesis of the clotting factors resulting in bleeding. Portal hypertension. And finally, we have hepatorenal syndrome. Due to increased nitric oxide in the periphery, the GFR decreases resulting in a renal failure. Chronic liver failure. It is associated with advanced fibrosis or cirrhosis. It is diffuse remodeling of the liver into parenchymal nodules, fibrous bands, and vascular shunting. Cirrhosis and chronic liver failure are often associated, but they are not synonymous. This means a liver failure may or may not have an underlying cirrhosis and vice versa. Now, some common sequence of events in liver failure are injury, followed by repair. Then we have regeneration, and finally the characteristic fibrosis. So in all, chronic liver failure is an ineffective attempt to repair ongoing intermittent or past injury. Now let us begin with the first pathology of liver, which is hepatitis or inflammation of the liver. Based on etiology, it is of two types. Viral hepatitis caused by hepatotrophic viruses, and the second one is autoimmune hepatitis. Viral hepatitis is caused by hepatotrophic viruses. Some clinicopathological symptoms: acute asymptomatic, clinically negative, with elevated liver enzymes and viral markers commonly seen in HIV and HBV. Acute symptomatic, where we have an incubation period followed by a symptomatic phase, and this is followed by a phase of convalescence or recovery. Next, we have acute liver failure, about which I have already discussed, seen in only 10% cases commonly associated with HIV and HEV. Chronic hepatitis occurs when the disease has persisted for at least more than 6 months and is commonly associated with HBV and HCV. Last but not least, we have the carrier states. Acute hepatitis. In acute hepatitis, we see signs of reversible cell injury in the form of ballooning degeneration of cells. Next, we can see signs of irreversible cell death, such as apoptosis in the form of apoptotic bodies or acidophil bodies. We have necrosis as well as cholestasis. Last but not the least, we see scant lymphoplasmacytic infiltrate in the portal triad. Although it is an acute inflammation, we see lymphocytes because it is also a viral infection. Chronic hepatitis. In chronic hepatitis, we see interface hepatitis, which is nothing but infiltrating inflammatory cells at the junction of portal triad and hepatocytes. We have the characteristic bridging fibrosis, which are fibrous strands bridging two vascular structures. Last but not the least, we have dense lymphoplasmacytic infiltrates in the portal triad. There are some differences between chronic hepatitis B and C. In chronic hepatitis B, we see ground glass appearance which are ER dilated with viral proteins. This is an image of how a ground glass appearing cells looks. In chronic hepatitis C, we see formation of lymphoid follicles plus fat vacuoles, mainly in case of HCV genotype 3. Autoimmune hepatitis. Coming to the pathology, it is same for any autoimmune disease. A genetic predisposition with drugs or virus or any other environmental insult. Together, these etiologic factors results in a hepatocyte damage. This damage produces an altered antigen. This antigen will in turn trigger the immune response, resulting in the formation of an autoantibody. Autoimmune hepatitis can be of two types, type 1 and type 2. The genetic predisposition for first one is HLA-DR3, HLA-DR4. For type 2 it is HLA-DRB1 and HLA-DQB1. The antibodies involved in type 1 are anti-nuclear antibody, anti-smooth muscle antibody and anti-soluble liver antibody. Type 2 it is anti-liver, kidney, microsomal antibodies. Age groups commonly affected are young adults for type 1 and children mainly in type 2. Last we see about the microscopic features of autoimmune hepatitis. We have interface hepatitis, emperipoiesis and finally rosette formation. This is an image of rosette formation. So thank you for watching this video. I hope it was helpful. If you enjoyed this video, please press the like button and share this video with your friends. If you are new to my channel and would like to see more such videos, don't forget to press the subscribe button. That's all for today. Have fun and stay safe.